All right. Hello, everyone. Welcome to Chris's Corner. We are here today on Wednesday. I'm on the West Coast, so it's early. It's 9 o'clock, but I know for some of you it's 11 or it's noon. So I am super excited to have a live stream for everyone to jump onto today and just get some OCD education. If you want to go ahead and announce yourself in the comments, go right ahead. We'd love to learn who's watching us, who's consistent with us, and where you're located. Also, we want to get to as many of your questions that we can today. So the more questions that we get, the more time we'll spend on that. So jump on in the chat from whatever social media platform you're using and make sure to comment from where you are and say hi to the panelists, to myself, and also get your questions in and introduce yourself. But we're so excited to have Chris's Corner today. As you know, it is back to school time. People are going back to middle school, to elementary school, to high school, and to college. So we are so excited to jump in today's topic. I know that a lot of people that watch this are professionals working with clients that struggle with some of these topics. We know that there's parents and loved ones as well as individuals with OCD watching. So going back to school obviously can be exciting and it can be nerve-wracking. And we know that OCD and related disorders loves to prey on change and prey on all of the unknowns. So a lot of people, including my clients, are coming up and just talking about the stressors that they're having now that they have to return to school. I think it's severely unique as well because this year, a lot of people are going back to school for the first time in about a year. Or a year and a half. So for many people, this is added social anxiety, added stress. So we're going to address all of those issues today on the show. Once again, make sure to introduce yourself, ask comments, say hi. Before I jump into introducing my guests, I do want to remind you that we are going to do everything we can here at the IOCDF to absolutely ensure that we are creating a safe environment for people to ask questions and open up a dialogue about mental health. However, unfortunately, we can't absolutely ensure that not everybody is joining in with our mission. So just think of that and be cautious as you join in. The other thing I'd like to remind you is for the IOCDF, we are here today to educate you and provide you with information on a very important topic, but we are not here to replace therapy or to be a crisis hotline. So if you look below me right now on the screen, we are giving you the suicide prevention hotline, or go to your local emergency room if you are at a place that you don't feel safe. So please make sure to use those resources instead of this. We are here to help and support, obviously, but you need that one-on-one in-person care if you're struggling. Hi to Kent in the UK. Oh no, Lynn Trev, who is from Kent in the UK. Obviously, I've never been there before, so that's why I didn't know it was a town. I'm so sorry that your son is dealing with undiagnosed OCD, ADHD, and maybe ASD, but that's why we're here today to support. So Chris's Corner is not about me. It is about my guests, and I'm super excited to introduce them at this time. So I'm going to start with a good lead advocate of mine. It's Miss Reverend Katie O'Dunn. So Katie O'Dunn is one of your IOCDF lead advocates who's doing amazing work in the faith and OCD field. They have OCD themselves, and she is going to be talking about her experience working with K through 12 and the struggles that they see in school. So Katie, do you want to give them a couple sentence intro? And thank you for being on the show.
Yeah, thanks so much for having me. I'm excited to be here. Like Chris said, I'm an IOCDF lead advocate. I have OCD, and I can really relate to being a young person with OCD navigating through school and through college. But now I work pretty heavily in the area of mental health and faith. I'm at an independent school with 2,700 kiddos from pre-K to 12th grade. Just ran up from teaching my 18-year-olds who at some point you may hear the bell ring because they'll be heading to lunch. And a lot of my day is really spent with them navigating all sorts of mental health issues alongside their faith, but also having conversations about my OCD and my experience to let them know that they're not alone and to be able to refer them to appropriate treatment. So happy to share my own experience, but also the experiences with the awesome kiddos that I work with every day.
Absolutely. We are so happy to have your personal experience, but also your expertise. I know a lot of people watching today are going to be dealing with some of the topics that you're going to bring up. So thank you. My next guest has been on the show before. I really, really liked having him. So I brought him back, Jelani Daniels. So Jelani Daniels is a college student. So he is going to be able to talk to his personal experience as he's in graduate school, as well as just, I know he's worked with Liz McInville at Peace of Mind, and he's done a lot of work in the OCD field and was an excellent guest discussing the need for more diversity for marginalized groups in the OCD community in a previous episode of Chris's Corner. So make sure to check that out. But Jelani, we're happy to have you. Maybe give a couple sentences why this topic means so much to you.
Sure. Thank you for having me. I think So with my experience, I've worked primarily with adults, but have worked with a lot of college age patients as well. But I'm also very much interested in working with more younger populations. And I know with the experience that I have had with that, oftentimes struggling with school is a significant part of what comes along with their struggles. And also working currently at practicum experience at Psychology Houston, in which I'm working with those who struggle with OCD, Tourette's, and body-focused repetitive behaviors. So those can very much interfere with one's ability to perform well academically as well as socially. And so a big part of what I want to be able to discuss here today.
Absolutely. Well, thank you so much for being back on the show. And then my next guest is Rachel Davis, who actually I was familiar with Rachel because Rachel has been part of the young adult track. I'm sure she's spoken at other talks as well, but she's been part of the young adult track at the IOCDF conferences discussing this very topic for young adults, because for a lot of young adults, obviously, as they transition into college or they're in their senior year or they're in graduate school, a lot of them struggle with their OCD, and sometimes they see the symptomology get worse when they're on campus away from home. So Rachel Davis has done some incredible talks on that topic and gotten rave reviews. So I had to have her on the show. So welcome to Chris's Corner. Why don't you introduce yourself?
Thanks, Chris. So I'm a psychiatrist, and I have several roles, but I'd say the roles that are relevant to this are I'm a medical director of the Student and Resident Mental Health Center on the Anschutz campus, which is a health professional campus. So we see medical students, dental students, pharmacy students, et cetera. And I also direct our OCD program, so I see general community members, and I've worked with a number of students, mainly from high school up with OCD. I also have OCD and Tourette's myself, so at one point I was a student with OCD, and so I can speak to that some as well. So thank you for having me.
Absolutely. Well, I'm so excited about my guest today. I'm your host, Chris Trondsen. I'm one of the IOCDF lead advocates. I'm also vice president of one of the IOCDF's official affiliates, OCD Southern California, and I treat OCD here at the Gateway Institute in Costa Mesa, California, and myself have OCD. So I'm so excited about my guest. Once again, make sure to put your questions in the chat for our guests. Also introduce where you're at. Hi, Deidre. It is so excited to see you. So thank you, everyone. Well, I want to jump right into this topic. I'm going to start with you, Rachel. Why do we see such a increase in symptoms when people are at school? So obviously, the IOCDF has created anxiety in the classroom, and this has been something that many people who are members of the IOCDF have been asking for because they see their loved ones, their children, et cetera, really struggling in school. So why do you believe that when kids are in school, some of their symptoms may increase or, exacerbate at times?
Sure. Well, I think there's many reasons. One of the reasons is change. Change is always hard for anybody, especially someone with OCD. Going back to school or starting school is also a big time of uncertainty. And as we know, OCD does not like uncertainty. And then people with OCD tend to have difficulties in several different cognitive domains. And school obviously requires that you use cognitive skills. And so that can certainly bring up things. Also just exposure to new people, new environments, a lot of new things. And so those are just a few reasons off the top of my head. But
absolutely. And Jelani, like when you're working with, kids in school and stuff like that, you were saying that you're working with kids that are in this age range of going to school. What are some of the main things that you hear from them that they're struggling about in school when they have OCD and related disorders?
One of the big things that can be very difficult is just being afraid for their symptoms to show in front of others. A lot of the shame and stigma that comes along with, rituals or compulsions or tics and hair pulling or skin picking, these obsessive compulsive related disorders as well. And they can be a significant struggle for them, and just, also adds to the anxiety that they experience. And so being able to help them in addressing these issues is also very important. And I think another thing that goes along with that too, which I think something maybe that we'll discuss more in a little bit, but being able to help teachers as well in those environments to be able to educate them so that they can be able to assist or provide assistance or accommodations for those students, as well as, compassion and care for them when they are in need.
You know, and I'm going to jump into that with you, Reverend Katie. I'm going to call you Reverend Katie because I always think that sounds so cool. You know, you and your introduction, you as somebody with OCD, you've definitely been very open to your students. I'll get to that in a second, but how, just like Jelani said, how have you seen that actually help administrators, staff, et cetera, recognize mental health disorders in your students and make sure that they're getting the resources and the support they need?
Yeah, absolutely. And I'm sorry if y'all hear something, the announcements are going for lunch right now. So if you hear anything over top of me, that's in the school field, right as we speak. But I think, you know, for me, I had a lot of shame initially sharing that. And now I'm really so glad that I have been open. In some ways, I've become kind of the resident OCD person on campus, person with OCD on campus for our faculty and for our counselors and for our teams and for our families. And I hear from multiple families a week that their child is struggling, or from teachers, and that their child is presenting in this way. And we Googled this thing and we think they might have OCD, and we found out that you know what this is and how can they get help. And we start to have conversations about exposure and response prevention. And I'm able to kind of push them into different places in Georgia that might be helpful and help them to get treatment. But I think it's really challenging. And being in a school setting with 2,700 kids, I see how prevalent so many, of course, different mental health disorders are. And so many of my students that are struggling and that come in and say, I'm having these intrusive thoughts, or I'm having these really scary feelings. I don't know what this is. Can you help me? But particularly with OCD, what I see from kids is kids that come in for the first time and are saying, why am I so miserable and all of my friends are having such a great time? Or why can my friends go off and play basketball and I'm sitting here and I'm worried that this thing is going to happen? And a lot of times that's a big flag for me for the first time that there might be something going on relating to OCD or an anxiety disorder, and that we might want to talk to the counselor or try to get them linked up with an ERP specialist.
Yeah, and obviously, like, catching it early, I think that's such a thing when we look at those IOCDF stats. Well, they're not IOCDF stats, but they put out the stats of research. I mean, we're still seeing the numbers staggering that it can be up to 14 to 17 years from first signs of symptoms to getting care. So I do believe that schools is such a great place to catch it. I'm going to jump back to you, Rachel Davis, and I'm going to go off of the question that we get from Lynn Trevo, kiddo at 1212. You know, their child is working at a school and is going to school, and the administrative staff hasn't caught some of these disorders. As somebody who's obviously with OCD and gone to school, and also now working with school age student clients, what are some of the failings that you see that, I guess that was a really harsh word, but as a person that went through school and was failed, I guess I can say that with OCD, right? But, you know, what are some of the things that they're missing? What are they not doing that you would love to see schools at any level start making a difference in, educating people on mental health disorders?
You know, that's a really good question. In my personal experience, I had symptoms since I was probably 7 or 8, and I wasn't diagnosed until my early to mid 20s. So it certainly wasn't picked up on in my school or by my parents. I grew up in a tiny rural southeastern Colorado town. But I can speak less to elementary school and middle school. I'm guessing Reverend Katie can probably talk more about that. I think in college, if you know that you're struggling or know that you have symptoms, even if you don't have a formal diagnosis, I think one of the things that you can do proactively is to enroll with disability services, even if you think you don't need accommodations. That way you're known to them, you know the process. They can support you if or when you do have needs. Unfortunately, a lot of it is left up to the individual who's suffering. I don't know that there's a whole lot of proactive, at least when I was in college, there wasn't a lot of proactive stuff done. Now on our health professional campus, we have done a lot of outreach. So we directly, we send an email out to the medical students and we ask them, would you like to be contacted for an appointment? And by the time medical students graduate, we've actually seen about 50% of them in student mental health. And so it is possible to do a lot of outreach. I just don't know that most college campuses do that or even have the bandwidth to do that.
Yeah, from my own personal experience, one of the things that I dealt with is going to those. I did the same thing that you recommended, and I'm not saying this is happening at every college campus, but I know for me, when I went and asked for disability student services, I definitely didn't fit maybe what they expected me to look like. And so one time I showed up, I had a meeting, and I showed up about 10 minutes early, and I'm sitting in the waiting room and can overhear it. And the girl is like, "Oh, it's the guy that we think isn't disabled, but is just trying to get services." And they were talking about me. And so, it was frustrating. And today's Chris would have mouthed off, but that Chris was so embarrassed and felt so stigmatized from accessing those services. So I'm going to jump to you, Jelani Daniel. How does somebody with OCD and related disorders, I know you also work with college-age students, how do they ask for resources when we maybe don't fit the bill of somebody that is accessing resources? Because when I was in that waiting room, I mean, there's people in wheelchairs, there's people with special needs, there's people with lost limbs. And so I'm sitting there not looking the part. How does somebody access that and kind of push through that stigma in college and other, school?
Yeah, that can be really tough. And I think it goes even prior to college and other grade school as well, where at least in college, it's going to require one to really advocate strongly for themselves, going with what Dr. Davis was saying. But even prior to that, really parents being able to advocate for the children, because there are going to be a lot of times where schools are reluctant to provide accommodations and services. And so you may have to fight with them, and it may be a battle along the way, but being able to be persistent. So I think also it's important to educate oneself on what your rights are. And so, when it comes to grade schools, being able to know about IEPs, so individualized education plans and 504 plans, which so IEPs tend to apply more to like special education, but there's a broad array. There's like 13 different disability categories in which one may be eligible to receive services under that sort of plan. And a 504 plan is one in which it's may not be as restrictive, but being able to provide accommodations, to allow a student to be able to remain within like that regular educational environment. And so I know I'm probably giving a lot of educational info right now, but I think it's important for parents to be able to educate themselves about these services that are provided, that apply to laws, that apply to, the IEP applies to the Individuals with Disabilities Education Act, so IDEA, and the 504 relates to Section 504 of the Rehabilitation Act, and so Americans with Disabilities Act. So educating yourself about this so that you could be able to bring this to the schools and be able to say like, hey, this is what you are mandated to be able to provide me. And so like being able to understand in your situations, what you are allowed to receive. And some situations are going to change depending on like whether you're in a private school or public school and whatnot. So being able to educate oneself on those is going to be very vital for this. And again, advocating for yourself, being persistent. You may have to fight and argue, but not giving up.
Yeah, Lynn, thanks you for your advice in the comments. And it is something that you have to be persistent about. I'm going to jump to you, Reverend Katie, in a second, but I wanted to go back to Rachel Davis. Jess at 1217 in the comments said this was their fear for signing up. What has been either your advice for yourself or advice for your clients if they are having my experience? I think some people in the comments related where they really do feel nervous asking for services because they maybe don't fit the mold of what the other students might look like. What are some words of encouragement, or what are some of the ways that you've maybe empowered clients or yourself to be willing to go and get those services, even if there's a little bit of fear of stigma because they don't fit a mold?
Well, one of them is, and it's unfortunate that you have to do this, but it's to be prepared to educate a little bit about what OCD is. If you can preemptively have a letter from your treating provider that explains OCD and it explains how that interferes with functioning, that can be helpful. And again, it's also unfortunate that this falls on the individuals, but if you can go in with a list of what sort of accommodations that someone with OCD might benefit from, and I don't know if we want to talk about that now, but we can talk about at some point what sorts of accommodations might be useful and that you could ask for, because yeah, the reaction is often, well, whatever, we don't even know what we would give you or how we would accommodate you. And so going in with information can be useful.
Absolutely. And I'm going to get back to you in a second because that is one of my questions. I wanted to jump to you, Reverend Katie. One of my experiences out here is there's a really predominant private school out here that's really well known. And I had multiple students get rejected from services because they did give services for people with ADHD, also with learning disabilities. But the person who was actually in charge of okaying different plans didn't feel that OCD was something that warranted services. And it was a private school and it was a lot of jumping through hoops. And like Rachel Davis was just saying, Dr. Davis, I had to go in and like educate. And it was actually from a presentation somebody did at the kids conference at the IOCD last year that has research show that there is some, like slower processing speeds with individuals with OCD. And that's what they see with other disorders. So then they finally granted that. So in the K through 12, how have you seen it? At your school, obviously you're an advocate, but in general, from maybe students that have come from other places or in the community, are people struggling to get those resources, or have schools started to kind of catch up with the times and realize that mental health disorders also need resources as well at school?
Mm-hmm. Yeah, that's an awesome question, Chris. And you're welcome to just call me Katie. I just put that on so we can always destigmatize the fact that folks in clergy navigate mental health issues too, but Katie's fine. But this is something that's so important. I consult with an organization called the Center for Spiritual and Ethical Education, and I get to work with schools all around the country around spiritual, mental health, grief, and trauma issues, and do trainings. And this is a conversation that we see happening often around accommodations and who's getting accommodations and what that looks like. I'm actually happy to say that right now in independent schools, there is a significant rise in the availability and openness to different accommodations, including those for folks with OCD. I know at my school in particular, I would say more than 50% of the students that I have in my classes, I teach about 80, 17, and 18-year-olds right now. I'd say more than 50% have some sort of accommodation. And that could be for a whole host of different reasons. And that could be as simple as extended time on tests. That could be as simple as a note-taking type accommodation, something where individuals can get up and move around if they're feeling anxious. There are all sorts of different things. And I think moving forward, I have plenty of folks who have accommodations for OCD. I see that with a lot of other schools too. Unfortunately, like you said, there are still some schools, some private schools, as well as public schools that might not understand that. And I think the accommodations directors, as well as the counselors who are doing scheduling, are very, very well intentioned. It's why everyone goes into those fields. They really want to help kids. They want to make a difference, but they really just might not understand. And I think it's our role as advocates to continue to spread that. I would say for my school, I have sent countless things around OCD to our counselors and to our accommodations director to let them know what students need from anxiety in the classroom. And the response is never negative. It's always, wow, thank you. We didn't know that this is what OCD was. We didn't know what individuals were experiencing. And it really opens up that door. So I think the willingness is there. I think the growth in accommodations is happening. But I also think the education still needs to continue to take place. And going back to what Rachel and Jelani were saying, in the independent school world, in the public school world, anything pre-K to 12, there is still some necessity, unfortunately, for individuals and parents being advocates when those accommodations are not necessarily given. I usually think of 8th grade and below, that parents most likely will need to have a conversation with the school along with those accommodations. And I usually recommend from 9th grade and up that the students start to be able to have those conversations with their teachers so that they're in a safe space to advocate before they move on to college and can express their accommodations so that they know what it is that they need.
Absolutely. And like Rachel Davis was saying earlier, I do also believe that, that's why it's so important to have that conversation with your therapist. And I want to jump in, back to you, Dr. Davis, but when you are meeting with your therapist, so I know there's a lot of people, and keep your questions coming, folks, we'll definitely get to them. What are some of the things, because of OCD and related disorders, what are some of those accommodations, either for you when you were in college, Dr. Davis, or for your clients? What are some of the ones that they find really effective that helps them navigate their education, do well, despite having, OCD symptoms and a fear? What are some of those specific, resource or accommodations people watching should be thinking about if they are going to get some resources from school?
Sure. And I think it's really important to think about which accommodations will be helpful versus which ones could potentially exacerbate the OCD. And so helpful accommodations could be things like testing in a room alone, having an emotional support animal in your dorm room, sometimes extended time on exams. Now that one's hit or miss because, the extended time allows you to reread and check. That may not be helpful. But sometimes people with OCD do just have slower processing speed, and so that extended time can be useful. Having a tutor, sometimes breaking up a very large project into smaller tasks can be helpful. And I'm reading a list here because I don't want to forget some. But missing class for a therapy or doctor's appointment is reasonable. Being allowed to miss class to do rituals is probably not something we would recommend. Maybe checking in more regularly with your professors, having the lectures recorded, getting copies of the lecture slides, maybe even early registration to secure classes at a certain time of day. So for example, if someone takes a sedating medication at night, that makes it really hard to function in the morning, allowing them to register early so they can get afternoon classes. Using audiobooks. So if someone struggles with rereading, audiobooks can help with that. Providing examples of what normal or good papers are can help with someone who struggles with perfectionism, just to see a template of, oh, this is what I'm striving for, not, this way up here. So a lot of our students have to go to away rotations. And so sometimes we ask for an accommodation that they can stay, rotate at places closer to campus so that they can continue to engage in their mental health treatment. Being allowed to step out of lecture for brief breaks. And then just briefly, what might be an unhealthy or unhelpful accommodation. So being allowed to leave class to do rituals. Extended deadlines. I rarely find that extended deadlines are helpful because all that does is it just allows for perfectionism and procrastination. And I've really seen that mostly perpetuate the OCD. Now, if someone has had, a mental health crisis, they've been hospitalized or something like that, that's a different scenario. I think an extended deadline could be useful. I think allowing someone to be late on a regular basis isn't helpful. It doesn't help the student. It doesn't help the OCD. And then I'll stop talking, but I could also talk about, maybe what would be a temporary or rare or kind of rare accommodations that might perpetuate or, I guess in the negative sense, accommodate the OCD, but maybe could be helpful in the short term, but a student could work towards decreasing over time. There are also some that fail.
Yeah, and a lot of those, thank you for actually listing those, because I think sometimes when people have OCD, they don't know what will help. And I know for me personally, what did help while I was in treatment was the extended time. And I know sometimes people can use that, but for me, I would start to just get hit with obsessions and I would need to practice my response prevention. And that took time sometimes. If I'm in the session, I'm having intrusive thoughts about harm and it's like I have to work through that. That's going to add time. And so that extended time allowed me to still finish the exam while fighting the OCD. But I agree with what you're saying about, making sure that the accommodations fit. Katie, I know you had a question for Dr. Davis.
Yeah, Dr. Davis, it's interesting. You brought up at the end something that I wanted to ask you a question about. I see all the time, and this is a more recent thing where students will have accommodations that might allow them to do rituals temporarily, and they will kind of slowly back off on that, where there might be students that it's okay, they are able to leave the class 5 times to do a particular ritual, and over time it's going to back off to 3 times or to 1 time. I wonder, from your perspective, one, if that's something that's helpful or harmful in school, but also what the best ways for teachers to be communicating with clinicians and navigating that might be, because I think some are starting to face that.
Yeah, I think if someone has an accommodation, it's funny, we use the word accommodation in this sense to mean a reasonable accommodation, which is a useful thing, versus the term accommodation in OCD is a bad word. So if someone has an accommodation that accommodates the OCD, it's just really important from the beginning that the goal is to decrease that accommodation, that this is not a long-term solution. So, for example, maybe class participation is required, but someone has social anxiety or OCD that, they fear they're going to blurt out something inappropriate. So maybe temporarily you could allow them to have one-on-one discussions with the professor with the goal of then working towards participating in class. I guess in terms of stepping out for rituals, I mean, I treated a student who was allowed to leave to do rituals, and it didn't help. Ultimately ended up avoiding school and class altogether. And so it's a slippery slope. I guess, it's not black and white. There's a middle ground. If it works for some people and it helps them stay engaged in class, then, that's probably a good thing. I think it's really all about doing what works and making sure it doesn't exacerbate the situation.
Yeah, we're getting some comments from people that they really like their list. Is that a place that on your website or somewhere that people can find that list? What would be the best way for them? Or maybe the IOCDF can share it if it's not somewhere public.
Yeah, I have it posted. Let me just find that link and I'll put it in the chat.
Yeah, perfect. So for Christina, yes, that list was extremely helpful. So Dr. Davis will definitely be putting it in the chat so you can access that. Jelani, I wanted to go to you. And this is already kind of alluded to by Katie and Rachel, but what would that look like as a therapist? How can somebody plat that? Because we are in this kind of conundrum. So in my own case, like I needed those specific accommodations, or I probably would have dropped out of school. However, for me, I didn't keep those accommodations throughout college. I, would use the ones I need, reduce some of them, and eventually eliminate. So how would like a family and a therapist and the individual with OCD, how would they navigate that process of making sure to get to a point where they know when it's time to let go? What would that look like in the treatment room?
That's a great question. I think the unfavorable answer is it depends, but I think as long as we see that there's improving functioning with what the client is able to manage, and I think definitely we want to allow them some autonomy and be able to determine what they feel like they can be able to reduce from. So if it's however number of breaks, as Dr. Davis was mentioning, all right, if you get 3 breaks a day or whatnot, can we get down to 2? And if they're like, no, I just need a little bit longer, it's like, okay, all right, let's try for a little bit longer. Let's try, but let's also wanting to encourage and kind of challenge and push them to be able to move toward that progress and not be too dependent upon not be too dependent on accommodations. One thing I did want to add, because I thought that list was great from Dr. Davis, because I also want to bring in, some of the related disorders. So again, with like tics or body focused repetitive behaviors, I think some additional accommodations where actually taking breaks can be helpful in some regards. Like if someone's struggling with their tics or whatnot, just needs a break just to be able to not having to face that stigma in the class of if they're struggling with their tics, or if somebody is struggling with hair pulling or skin picking, just to being able to have some accommodations, such as like being able to wear a cap, or being able to have an accommodation of like not having to do like say some sort of activity that's going to expose their maybe bald patches or bald spots or whatnot, say like swimming or something of the sort. So being able to have some accommodations that will like either delay them having to take that course or having something that could just spare them that type of shame and stigma and exposure. But again, going back to your question, Chris, I think just how we look at that, again, just going through the process, seeing how they're improving upon the functioning. One thing that we'll also want to add is I think it is also important for therapists to become involved. I think we were mentioning earlier about being able to provide documentation or a letter to, or for the students to provide to the disability services, say at college or to the schools. But say with other plans or with like the IEP programs, like you can play an active part within that type of planning. Like the IEPs are quite extensive or comprehensive, and they involve a lot of different peoples, in terms of teachers, school psychologists, counselors, whether it be some sort of advocates or behavioral specialists, and all sorts of people, where they actually come together to be able to compile and create this sort of plan. So being able to be involved as a clinician in that regard is very helpful for these patients, because otherwise there have been cases that I've heard of in which when a therapist wasn't involved or a clinician wasn't involved, that the child was deemed to have some sort of like behavioral disorder, as opposed to seeing that this was more like anxiety or OCD or something that was causing that when it was manifested, it looked like something else to people who were not educated in understanding that it was really something other than what they were believing. So for therapists and clinicians to be involved in this process can be very helpful, and if anything, very essential.
Yeah, no, and thank you for bringing up related disorders. I worked with a client, and PE at their high school was going to force them to swim, and obviously they had spots. And what we did is we actually used that as motivation. That's why accommodations can sometimes be helpful. We really worked on using that as one of the values, as they really wanted to swim because they enjoyed it. They wanted to be able to swim in class with their friends. So that was one of sort of the things that really motivated them to hair pull because of that. So accommodations could actually be helpful. I wanted to follow up kind of what Jelani was talking about with you, Katie. How do you navigate that? Because sometimes people with mental health disorders, ADHD, OCD, depression, anxiety can kind of get pinned as like a problem child or behavioral problems and not get the resources they need. Also, ADHD, a lot of times people with OCD get misdiagnosed with that because they're difficulty paying attention in class. They're struggling with focus. They're distracted by thoughts, and easily, ADHD, they go on a psychostimulant. We know sometimes for individuals with OCD that can actually make their anxiety worse. So how does someone navigate to make sure, watching this, that their kid or their patient client doesn't get like deemed a problem child when it's really just a mental health disorder that can be treated?
Yeah, Chris, that's a great question. It's always interesting, and I always try to not step on toes because I know that I'm not a clinician and that I can't diagnose, but I definitely, knowing a lot about OCD and having experiences with that, will see kids in my class that will have an accommodation, and I'll see the diagnosis that they have, and I'll watch them throughout the class and think there's something else that's going on here. And like you said, often ADHD, they might be on a medication that they're not excited about for ADHD that makes them feel awful and anxious. And I see this other anxiety piece that's going on. So in that case, at least for me, I try to have a really open relationship with the kids. Again, work with pre-K to 12, but I spend most of my time with high school kids. And if I see something with a student that they're struggling, or it looks like there might be something going on that they're not getting help for, I'll come up with a creative way to say, hey, do you want to come by and chat? And usually they will, because I get to know them, and I'll ask them point blank, kind of, how are you feeling? What's going on? I can see you're a little distracted in class. Is there anything that's causing you anxiety? And for me, and I think this really helps with educators, without putting all of my stuff on them, I try to let them know, and also I have OCD and I kind of struggle with some stuff too. Here's some of the things that I experienced when I was in school. And a lot of times students will just start pouring out, well, I'm having this intrusive thought, or I am feeling like I have to do this particular thing to alleviate anxiety. And if that happens, again, I know that it is not my role to diagnose. I will either go and talk with a counselor directly who I know knows about OCD, or talk to the student about, hey, do you feel comfortable if we call your parents and maybe get an evaluation? Because I think there are some things that might be going on where we can make you feel better. And I always try to present that to them as It's because you are so awesome and you deserve to feel amazing and great. And this isn't, I always try to let them know that it's not me stigmatizing them. It's really trying to bring out the best version of them because I think they're so wonderful. And hey, let's really chat with your parents together to see if we can make you really feel good and get to enjoy the experience of going to school.
Yeah, and I think it's so important just to open that dialogue and that conversation and, just presenting that and then somebody, being able to get the resources. But I think it's so important if, your kid, for instance, if you're watching this and you have a child in school or you're a person with OCD in school yourself, to make sure to advocate that you aren't deemed like a problem child. I think what kids with ADHD are constantly thrown into like behavioral issues when it's really just that, or kids with OCD doing rituals, it's that they're seeking attention. It's like, no, it's none of that. We just need to have better, it's our responsibility as the adults in the room to figure out how to help versus to deem them the problem.
Mm-hmm. And Chris, I think I'm so glad you're saying that. And I hope that if educators are watching, they're really hearing that. And I think that can be, that can sometimes happen where you see students doing particular things and you make the assumption, oh, they're just not paying attention. Oh, they're just not doing their work. And really being able to acknowledge that most of the time they're doing the best they can and there's something else going on. And it's our job as educators, not just to teach them, but to help them be the best version of themselves. And that for educators, if you open yourself up, and again, maybe don't share so much that the students feel like they have to care for you, but let them know that you navigate things too. Generally, you'll have students that end up opening up to you, and it'll give you more room to push them in the directions that they need. I have students, I just had one a couple weeks ago that reached out to me that graduated 4 years ago that remembered me talking about my mental health and said, okay, I have these scary thoughts. I can't tell anybody. I remember you talked about some of this. Can I talk to you? And I think it makes a really big difference for kids just to be authentic and to let them know that they're not alone.
Absolutely. And they'll remember that. Rachel, outside of Dr. Davis, outside of accommodations, what are some things individuals with OCD can do on their own to help with certain issues that come up with OCD and related disorders and in school?
Sure. So, I think a common problem is being so distracted by obsessions that it's hard to kind of do the work. And I remember when I first got to college, I was just completely overwhelmed, and I was in my dorm room and I thought, I can't do this. This doesn't, this just isn't going to work. I was trying to study. I couldn't study. I was distracted. And I don't remember how, but somehow I discovered Barnes and Noble. And from that point on, I only studied at coffee shops, and it was amazing how much of a difference that made. I mean, yes, it was distracting, but the distraction of the people around me kind of helped tune out the obsessions, and I was actually able to study. I did have problems with set shifting, like moving from one topic to another. I would feel like I had never learned enough, so I could never move on. And so what I would actually do is I'd move from coffee shop to coffee shop for different topics. It really helped me to study with other students, especially to rein in my perfectionism, because if I could kind of follow their lead and learn what they were learning, that was that helped me understand maybe more what was necessary versus I'm trying to learn every single thing. Getting examples from professors about what is expected, like what other people have turned in that is good or acceptable, was really helpful to me, because I might have something in my mind that's way out here that I would spend hours and hours and hours on that wasn't at all what was expected. I'd say those are some of the main things. Also, if we want to share my PowerPoint at the end, I have a list of a number of other things that students can do on their own that don't require accommodations.
Yeah, no, what we'll definitely do is we'll have the IOCDF post it somewhere, so that way people who watch can access the PowerPoint.
Okay.
That'd be super helpful. Jelani, I want to shift a little bit, and I want to go to you. So we've talked about the academia component. Let's talk about some of the other stuff. So individuals with OCD and related disorders deal with stuff outside of academia. So like you're saying, people that skin pick or hair pull, now they're going to school and they might have scarring on their face from picking, or they might have patches of their hair gone, or, oh, yay, we shared your PowerPoint in the chat. Good. Access that, people. You know, but we also have people that just having to leave the classroom to go take accommodations, then they feel embarrassed. People with OCD are dating in high school, college, hopefully not middle school. I guess you know, everybody has their little, you know, partner in middle school.
They are.
Yeah, they are. I know. I mean, next thing we know, yeah. But how about some of that? You know, how does somebody navigate school? How do they tell friends that they meet? How do they date with OCD? Like, talk a little bit about just the experience that you hear people with OCD and related disorders having to navigate school outside of the academia component, and maybe some of the things that you found helpful for them.
Yeah, I think so. One of the main things when it comes to being able to, I guess, connect with others and letting yourself be vulnerable, which is actually what Katie was getting at in terms of with her and her students, is being able to open up and being vulnerable, which may have some risks of being rejected or being judged and stigmatized, but also has the potential of leading to greater connection and bonds with others, as she also demonstrated in that student who reconnected with her over issues that they were struggling with. But I think being able to start off with being able to open up to those who you really feel that you can trust, you know, doesn't mean that you need to open up to everybody and all your friends and social media and all your family. You know, I'm sure most people can recognize who they can trust and who is open and warm and compassionate, and being able to start off there and be able to take baby steps and be able to open up and discuss things. Because I think one of the big problems when it comes to stigma and shame is that the general public often doesn't realize, they don't know much about these issues and struggles. And so the more that people can open up and say, like, well, this is actually something I struggle with too. And, you know, kind of like, I think what you were saying, Chris, earlier, that people didn't think that, you know, like you didn't fit the part, but now he's like, no, well, I am the part. Like see that, you know, this is the face of, you know, I think one of the past campaigns for IOCDF was like, you know, this is the face of OCD, or actually I might be getting confused with Peace of Mind and Liz McInville, but
it was both. I think it was a collaboration of like, this is what OCD looks like. I know Liz was the first face. I was part of it, but not as exciting as Liz. But yeah, I mean,
you're great too.
right. I got a compilation prize, but no, like it is like, hey, this is the face of OCD. I think people think mental health looks how it did in the movies in the 80s and stuff, with somebody with a straitjacket screaming in the corner, and it's like, no, I mean, people could look like they're, you know, not dealing with anything yet be struggling.
Yeah, and I think being able to also, I think the general public, you know, it's so skewed in terms of what they understand about OCD, where it could be seeing it as this kind of like gimmicky, like I'm just like quirky and I like things to be a certain way, which is wrong. It's not OCD, or even seeing it to some extreme in terms of interpreting intrusive thoughts as somebody who is horrible and evil and bad and whatnot. And so being able to, again, the more that we can open up and spread awareness and saying like, no, this is something I have, but this, you know, my thoughts don't make me who I am. You know, I'm not a bad person for having this. And I know people with OCD struggle with even those thoughts and wondering whether or not they are bad for having that. But, you know, being able to learn and receiving the therapy to know that you are not your thoughts. This doesn't make you who you are. The vast majority, if not everybody, has intrusive thoughts. Actually, I think everybody has intrusive thoughts. But, you know, again, so this is a lot more normal and common than people also realize. So being able to normalize this too, I think is very important. And like, okay, you're not abnormal, you're not alone. There are support systems such as IOCDF and others to be able to reach out to and be a part of a community so that you don't feel alone.
Absolutely. And Dr. Davis, you were talking a little bit about how you navigated the academia component. How did you navigate the personal life component of being in school? How did you tell maybe roommates or tell people you dated, or how did you open up about that? And was it easy for you, or did you find it a struggle dating and all these other aspects of college life while dealing with OCD and related disorders?
I wouldn't say I navigated it well.
That's always okay. You can teach people what not to do. I love it.
So I made a few friends. So I did have a few friends, but I didn't date. And I mostly spent all of my time studying. at that point, I wasn't diagnosed and I wasn't getting treatment. So my studying was really out of control. I mean, all waking hours, I felt I had to be studying. And so, I did attend some groups, and in medical school is when I finally got treatment. But I ultimately decided I just had to take one day off a week. And but even then, I wasn't really navigating social things very well. I was doing things by myself. So it was. So I guess I'm an example of what was kind of painful at the time. It maybe wasn't the best way to navigate things. So yeah.
Well, I'm glad you're saying that, because I think in my own story too, I did it wrong. I didn't open up to friends. I tried to hide it, which just made it worse and more embarrassing, because I would have to leave things early, or I'd say no to going out with friends and lost a lot of friends. Dating was really hard because I was embarrassed and kept it secret. So I guess, what I would want to say to somebody watching this now that's trying to navigate the things outside of academia is just like, you were saying, Jelani, is I don't think you have to open up and be completely blunt about everything that you're going through. But, those people that you trust, or the people that you feel safe with opening up about some of it and just explaining, like, this is why it's hard for me to call you back. Or I had perfectionism like you, Dr. Davis. So for me, it was all about getting A's and doing really well. And so I'd say no to things if I thought it was going to impact my, my grades. And so I wish I would have been more open and found resources and didn't feel so shamed. And so I hope everybody's, one thing that they're taking away from this is that it is okay to open up to roommates and to friends and to teachers and put on social media if you're ready. And you can always decide how much or how little, you want to do as well. So I wanted to jump to you. Oh, go on, Jelani.
I just wanted to piggyback on that too. And I think that one other thing that can be surprising is oftentimes when you open up, you may find people that you didn't expect. They're like, oh yeah, I do that too. And like, I'm glad they like find somebody else who struggles with that as well. And so, again, it opens you up to connection and being able to see that that you're not alone, and that you may be surprised that others share similar struggles.
Yeah, I wanted to ask you, Katie, with your students, outside of the academic component, what are some of the ways that you see not only OCD, but obviously there's other struggles, whether it's depression, kids struggling to shower or to leave the house or to be at school on time, tics that are very external, and kids are seeing that. Like, what are some of the other things, like, dating, your kids are dating already. What are some of the other difficulties you see kids with OCD related disorders, other mental health disorders struggling with in school? And what are some of the tips that they could use, or some of the things that you support them with?
Yeah, I mean, all of the above that you just mentioned. I think some of the biggest things that I see are students who, yes, are struggling to get to school on time, who are struggling to get out of bed in the morning and then maybe get to school, and are disciplined for not getting to school on time, when it's really that they were having trouble getting out of bed because of their mental health concern. It might be students that really, I see a lot of students that have a really great group of friends, but they are having a tough time because they have a lot of shame that their friends don't necessarily know what it is that they're going through, and then they don't feel worthy of hanging out with their friends, so they end up in my office. I have students who feel like because they didn't do perfectly in a play or on the field at a game, that they cannot come to school and face their friends because everyone is going to hate them and think they are the worst person in the world. There are endless things that I could name. I think the tips that I have for anyone listening are go back to kind of what Jelani said of please be willing to open up, whether that's to a family member or to a friend or to a trusted teacher. Please know that you are not alone. Anything that you're experiencing, whether that is thoughts or feelings, it is not a reflection of who you are as a person. There is nothing wrong with you, and you deserve to really get that help that you need. I relate in many ways. I said that I struggled for a long time, and I relate to my students. I was struggling my first few years as a chaplain, where I hadn't been treated fully, and had a pretty major episode actually after the loss of one of my students to a mental health concern, and it completely destroyed me, completely rocked my world. And I finally got the help that I needed. And that's when I started opening up really for the first time, both because of my journey, but also in honor of the student that was lost, because I didn't want any students ever again to feel like they didn't have someone to talk to, or that they were the only ones that were struggling with this type of issue. So I would just say to everyone that's listening, you are not alone. You can share what it is that you're experiencing, and there's help. For educators, and I'll put this in the link as well. If you're listening, I think creating spaces for your students, if you are seeing these things, or if you're not, just because students are also struggling with things that we do not see. So for me, we do roses, buds, and thorns at the beginning of every class, where every kid, I go around and they get to say something they're excited about, something that they're dreading, and something that's unfolding for them, as they wish to. It depends. They can kind of pick and choose. And at the end of every class, we do a checkout form, and they know it's private. It is just to me. It has a feelings wheel on it that they can put how they're feeling, and it has a blank to let me know anything that's going on with them that they just happen to want to tell me, in addition to class stuff. And you would be amazed the amount of students that put in there, I am feeling depressed. I am having this intrusive thought. I am afraid to go home because of X, Y, and Z, just because someone is actually asking them outright. So I would also encourage, I got off track a little bit, but educators to do that as well, and create those openings and create those spaces for students who might not be presenting to share what they're experiencing.
Thank you for that. I want to give go on, Jelani.
I just wanted to say, well, for one, those are excellent points that Katie is bringing up. And I think being able to extend that also to parents, and being able to opening up that communication with your child, and like checking in to see how they're doing and looking out for the signs, and also being careful and not expecting too much for them and putting too much pressure as if they need to get straight A's, or that they need to be involved in so many extracurricular activities or whatnot. Like being able to, be mindful of what they are capable of handling and managing in the moment, and what their needs are. And also being able to model for them like some healthy behaviors, because it's also going to be important to be able to, do things like getting adequate sleep, and being able to eat healthy, and doing some of these other extra things on the side that are important for mental health in general. And being able to model that it's okay to make mistakes, and that there's making room for that, and that perfectionism is not expected or even possible. And so but just being able to open up that communication and listen and validate your child and their concerns, and being open, and rather than lecturing and trying to force them and pressure them. So I just want to add that.
No, thank you for that. And Dr. Davis, I'm going to give you the final question. I think this one's amazing. It was from about 2 minutes ago. It's from Roxanne on YouTube. And the question was that, or the comment was that, when they do feel like they open up about their just right OCD, a lot of people will respond with like, oh, I'm a little under OCD too. I totally understand that, while they're being tortured. What would be your advice? Let's say for Roxanne or anybody watching, they're hearing a lot of us say, like, feel comfortable opening up. How do they respond if somebody does minimize their experience by saying like, oh yeah, I do that too. I love to have all wooden hangers in my closet. What is maybe a good way to respond to something like that?
I would just say something like that. That's actually not what it's like at all. And can I tell you a little bit about what it's like for me? Or maybe that's like the tip of the iceberg, but there's so much more. And can I tell you what it's like? Because most people don't mean harm when they say that. They're trying to relate. They're like, oh yeah, in a sense, it like normalizes it, but not in the way that, is useful. So I think one, keep in mind, usually when people say that, they're well-intentioned. And then two, just ask them if they're willing to hear a little bit more about what really goes on for you with OCD.
Yeah, what I always tell people, it's an opportunity to educate. One of my projects in grad school, you can buy like really cheap stuff and put labels on it. So I ordered hand sanitizer, and on it I put a label that said, I didn't write it, but I ordered it, and it said, Just because you use me doesn't mean you have OCD, find out more. And then we put the link to OCD SoCal. And we actually saw like a spike in website hits that month because I was passing them out like hot flies on campus. But that's what I love to do, is if somebody makes an inaccurate comment, it's just educate and say, oh no, you don't have OCD, you just like to keep things organized. Let me tell you about intrusive thoughts and hours of rituals. And a lot of times people are open and happy to it. Some people not. Some companies take advantage of that, and that's just absolutely terrible. What I wanted to do, because I know we have like 30 seconds, just a quick from each of you, maybe just a sentence or a message of hope for people watching, that they can get through school and that it is a difficult time, but it's not impossible. I'll start with you, Dr. Davis. What's like a message of hope you can leave everybody with?
Well, I guess what I want to say is I came from a family where mental illness wasn't a thing. I came from a town of 800 people where mental illness wasn't a thing. I came from a religion where mental illness wasn't a thing. And I was so ashamed. And I think that's partly why it took me so long to get help. But I have to say, when I finally caved and I saw someone, it changed my life. I felt human. I could relate to people. I enjoyed things. I had space. And so I guess that's my message of hope. If you come from a background where this isn't a thing, you're not allowed to get treatment, is I'd really encourage you to, do what you can to push through and ask for help, because it has made such a difference in my life. So.
Beautiful. How for you, Jelani, what's your last final message of hope for everybody watching?
Yeah, so briefly, I'll say that, and even this kind of addresses what Deidre was just stating and being released from her job. I would say, like, advocate for yourself, educate yourself in terms of, your rights, because, OCD does fall into the categories of a disability. And so you can get services or accommodations or whatnot. So advocate for yourself, educate yourself, and parents, educate for your children, be persistent, and don't give up.
Love it. And how about for you, Katie? What's your final message of hope?
Yeah, just know, for whether you are a teacher or a student or a parent, for anyone navigating OCD, you are so much more than your OCD, and you deserve to get treatment, and you deserve to get exposure and response prevention or another evidence-based treatment so that you can live into your beautiful values and the life that you deserve. And know that I'm a teacher, I'm an educator, I'm a chaplain, and I have OCD, and there is no shame around that. And each of you deserve to do what you need to do to live into your beautiful life.
Yeah, my final message of hope, and I said this, all the time, is that my first degree took 7 years, and there's a lot of people that just were like, hey, maybe school's not for you, but I fought through the OCD and was able to go on to get 3 degrees and now become a treatment provider. So I think not giving up is super huge. Getting my master's of science was one of the best moments in my life, and I would not have had that experience if I listened to all the people that were like, maybe it's just not for you. There's other things you could do. So definitely keep fighting. I want to thank all of my guests today. Obviously, Dr. Davis, Jelani Daniels, and Reverend Katie O'Dunn. Thank you so much for sharing your wisdom, your experience, both clinically and personal. This was absolutely amazing. There's so much good resources, and I hope everybody shares this with somebody that could absolutely use the information presented today in the live stream. Quickly, I want to make sure you go to iocdf.org/peace of mind. That way you can find out about all the upcoming programming. This is a great live stream, but there's so many other great live streams coming. I know Katie hosts some. We have Ethan, we have Liz, and we have others. So make sure to check that out. And then finally, one of the best things the IOCDF does each year is their conferences. I know we have a conference coming up that is in Spanish for Spanish speakers. And then we also have the big October conference, the online conference this year. And we are finger crossing we'll be back in person next summer. So make sure to go to iocdf.org for all information OCD. Thank you so much for everybody watching and sharing your comments. The show wouldn't be what it is without you. And finally, one last thank you to my guests, because without them, you would have had to hear me ramble on by myself, and nobody wants that, not even my own parents. So thank you so much for coming out. Welcome to Chris's Corner. We'll be back in 2 weeks, same time. Thank you, everyone. Thank you, guys.